This is Health Broadcasting Service, HBS Radios, your global pioneers in specialist radio broadcasting, bringing you everything to enhance your health and well-being. Health is your human right. HBS, your partners in everything about your health and well-being.
Health Broadcasting Service News Update. As Omicron ebbs, England revives Plan A, living with COVID, according to Reuters report. Here's a summary of the news update today, the 27th of January 2022. Plan B COVID-19 measures expire in England on Thursday. Beleaguered Prime Minister Johnson bets on boosters and antivirals. Omicron's lower severity and boosters improved outcomes in January. But experts say endemic COVID may still be common and deadly. After an uncomfortable but relatively brief return to coronavirus restrictions triggered by the Omicron variant, England is going back to Plan A, learning to live with a disease that is probably here to stay. The bet is that booster jabs, antiviral pills, and Omicron's lower severity will enable the government to manage outbreaks of a virus that cannot be shot at. Other countries equally keen to unshackle business and personal freedom will be watching. Work from home guidance ended last week, and measures such as mask mandates and COVID passes, also introduced in England last month, lapsed on Thursday, returning the rules to where they were last July. The UK Health Security Agency is preparing to switch focus to supporting vulnerable individuals rather than imposing national rules, according to a draft policy seen by Reuters. As we evolve to move to living with COVID, UKHSA's COVID-19 response will move from a whole-nation approach to a targeted response focused on protecting the vulnerable, read the paper titled UKHSA COVID-19 Vision Draft. We will ensure that our future response is more streamlined, flexible, and convenient for citizens and delivers value for money. British Prime Minister Boris Johnson, who has presided over a death toll of 150,000 that ranks 7th in the world, was forced in December to introduce the Plan B restrictions, angering some of his own lawmakers. He now has a strong political imperative to scrap them. As police investigate gatherings at his offices during COVID lockdowns in apparent violation of laws he had himself imposed, he faces the biggest crisis of his career, while many of his members of parliament are determined that he must return life to near normal, becoming endemic. Conservative lawmaker Andrew Bridgen told Reuters that COVID-19 restrictions were unlikely, unnecessary, and politically impossible. Johnson himself told lawmakers last week, as COVID becomes endemic, we will need to replace legal requirements with advice and guidance. He also said he would let the law that obliges people with COVID-19 to self-isolate lapse in March, and even look to bring that date forward. Much of his confidence stems from the nature of Omicron, which drove infections to record levels in December without increasing hospitalizations and deaths to the same extent. Graham Medley, chair of the government's COVID modeling group, told Reuters that when Plan B was introduced, the severity of Omicron and the impact of boosters had been unclear, In the event, even at the peak with social restrictions stopping short of a full lockdown, daily deaths stayed below 300 on a 7-day average compared to more than 1,000 a day in the third national lockdown a year earlier. Medley said growing immunity, with 83% of over 11s having had 2 doses of vaccine and 63% a booster, meant each future wave should be less challenging, though there might be hiccups. Whilst I expect next January to be better than this one and the following January to be better than next January, I wouldn't be surprised if at some point we have to go backwards. There is also a potential new resource in the shape of antiviral drugs aimed at preventing high-risk individuals who catch the virus becoming seriously ill, but not yet rolled out widely. Things have changed so much over the last 6 or 7 months, said Akishtan Mistry, 58, who was included in the panoramic trial of Merck's Molnupiravir after catching the virus. We've got a clear path going forward. I'm optimistic now, Mistry said on a video call from Bradford, where he was self-isolating. His view was echoed by Health Minister Sajid Javid, who said, "Our vaccines, testings, and antivirals ensure we have some of the strongest defenses in Europe and are allowing us to cautiously return to Plan A, restoring more freedoms to this country." Not yet there. But evolutionary virologist Aris Katsurakis of Oxford University warned that diseases such as malaria and polio may be endemic, but are not harmless. A disease can be endemic and both widespread and deadly, he wrote in the science journal Nature. It frustrates me when policymakers invoke the word endemic as an excuse to do little or nothing. A relentless focus on managing COVID rather than preventing infections also has unwanted side effects. Because National Health Service resources have been diverted towards vaccination boosters, thousands of other appointments have been postponed, adding to a backlog of elective care in the state-run system. At the same time, high infection rates among staff and patients continue to weigh heavily on hospitals. It's about living safely with COVID. It's not just about living with COVID, said Matthew Ashton, Director of Public Health at Liverpool City Council. We all desperately want the pandemic to end, he added. Minimizing disruption is part of that solution. I definitely feel like we are on the journey towards living safely with COVID, but I don't think we're there yet. Nick Thomas, a family doctor in Witney, Central England, supporting the panoramic trials, said local practices were also feeling the strain despite the success of vaccines and the prospect of effective antivirals. We have to manage all of those other conditions as well as an Omicron wave right now. And so that balance is really important. And the more tools we have, the better. And that is Health News Update coming to you from the Health Broadcasting Service. Please stay safe and remain healthy.
This is Health Broadcasting Service, HBS Radios, your global pioneers in specialist radio broadcasting, bringing you everything to enhance your health and well-being. Health is your human right. HBS, your partners in everything about your health and well-being.